Space-occupying lesions, of the liver, refer to non-cancerous growths or masses in the liver. These lesions are usually detected incidentally during imaging studies, as they are often asymptomatic. They have a good prognosis and rarely transform into malignant forms. Below is a detailed discussion of the common benign SOLs of the liver. 1. Hemangioma. Definition. Hemangiomas are the most common benign liver tumors, composed of clusters of blood vessels. Epidemiology, more common in women, often discovered in individuals aged 30 to 50. Pathogenesis, thought to be congenital vascular malformations. Clinical features, asymptomatic in most cases. Large hemangiomas, 5 centimeters, may cause symptoms such as abdominal pain, fullness, or nausea, rarely rupture or cause hemoperitoneum. Imaging, ultrasound, hyperechoic lesion with well-defined margins. CT MRI, peripheral nodular enhancement with progressive centripetal filling. Management, observation for small asymptomatic lesions. Surgery or embolization for symptomatic or complicated cases. 2. Focal nodular hyperplasia, FNH. Definition, a benign hyperplastic lesion often arising in response to abnormal vascular flow. Epidemiology, second most common benign liver lesion, more common in women of reproductive age. Pathogenesis, associated with vascular malformations or increased arterial flow. Clinical features, usually asymptomatic. Large lesions may cause mild discomfort. Imaging, ultrasound, isoechoic or slightly hypoechoic lesion. CT MRI, central scar with delayed enhancement. Management, no treatment required for asymptomatic cases. Rarely surgery for symptomatic cases. 3. Hepatic adenoma. Definition, a rare benign tumor of hepatocytes often linked to hormonal factors. Epidemiology, predominantly seen in young women, especially those using oral contraceptives or anabolic steroids. Pathogenesis, associated with hormonal influences and metabolic disorders. Clinical features, asymptomatic or mild abdominal pain, risk of complications like rupture, bleeding, or malignant transformation. Imaging, ultrasound, hypoechoic or mixed echogenicity. CT MRI, well-demarcated lesion with possible lipid-rich content. Management, discontinue hormone therapy. Surgical resection for symptomatic or large lesions 5 centimeters. 4. Cysts. Definition, simple hepatic cysts are fluid-filled cavities lined by epithelium. Epidemiology, common and usually congenital. Clinical features, mostly asymptomatic. Large cysts can cause pain or compress adjacent structures. Imaging, ultrasound, anechoic lesion with posterior acoustic enhancement. CT MRI, thin-walled, well-circumscribed cyst without enhancement. Management, observation for asymptomatic cysts, aspiration, sclerotherapy, or surgical resection for symptomatic or complicated cysts. Ha5, echinococcal hydatid cyst. Definition, a parasitic cyst caused by Echinococcus species. Epidemiology, common in endemic areas, e.g. Mediterranean, Middle East. Clinical features, may cause abdominal pain, discomfort, or hepatomegaly. Risk of rupture or secondary infection. Imaging, ultrasound, multiloculated cysts with internal septations or daughter cysts. CT MRI, cyst with calcifications and daughter cysts. Management, antiparasitic therapy, e.g. albendazole, surgery or percutaneous aspiration for larger cysts. HAP6, nodular regenerative hyperplasia. Definition, a rare benign condition characterized by diffuse hyperplasia of hepatocytes. Epidemiology, associated with systemic conditions like autoimmune diseases or medications. Clinical features, asymptomatic or portal hypertension symptoms. Imaging, nonspecific, may require biopsy. Management, treat underlying condition. Manage portal hypertension if present. Diagnosis of benign SOL, history and physical examination. Look for risk factors like hormone use or symptoms like pain. Imaging studies, ultrasound, CT, and MRI are pivotal in characterizing liver lesions. Biopsy, reserved for indeterminate cases or when malignancy is suspected. Key differentiators from malignant SOL. Benign lesions are often asymptomatic, slow-growing, and lack invasive or metastatic behavior. Imaging characteristics, e.g. central scar in FNH or specific enhancement patterns in hemangiomas, help distinguish benign lesions. Conclusion. Benign SOLs of the liver are common and generally have an excellent prognosis. Proper identification using imaging and clinical correlation is crucial to avoid unnecessary interventions. Most lesions require minimal or no treatment unless symptomatic or at risk of complications.